Welcome to Frankly Speaking with Dr. Wade. This show was created for and inspired by the thousands of patients I've served. So it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights diving deep into topics of controversy to bust through the sugarcoating that keeps you and your family stuck in the mainstream. Hello, everybody, and thank you for joining us today. We have a special guest with us. I'm very honored to have my esteemed guest here, Dr. Lou DePalma. He's a good friend and he's brilliant. He's going to share some pearls with us tonight regarding some basic misconceptions about digestion, how we use nutrients, and really take a broad stroke. We can dive deep in a couple of areas that will help elaborate. But the key is the knowledge about macronutrients is there's a lot of assumptions made about whether we get, we eat things, but do we get them? And Dr. Lou is going to show us why that doesn't always happen and how you can improve it, which then will help you use more of your micronutrients and maybe have to take less pills overall because you're actually digesting your food better. So without further ado, Dr. Lou hails from Madison, Wisconsin right now, and he is a holistic healthcare provider, chiropractor for years. And since he's been retired for how long now?
5 years now.
From practice?
If you want to call it retirement.
Yeah, he's not fully retired, but from practice, he's retired from seeing. Actually, you're not even retired from seeing patients.
Right, I do see a few patients a couple of nights a week.
They still find you, don't they?
They certainly do.
So Dr. Lou had a couple practices out on the west coast of Santa Barbara area, as well as Salem, Oregon. He's a graduate from 1981 and started using enzymes in his practice in 1986. And from there, the rest is history. So Dr. Lou, tell us about yourself and how you got to this point.
Well, when I first got into practice in 1981, I had taken over a practice, a 35-year-old practice as an older gentleman, and he had a lot of supplements on his shelf. And of course, you come out of school and you think you know a lot about nutrition. And really, nutrition, from a magic bullet perspective, is just like flipping a coin. You give a supplement to one person, they respond. You give it to the same supplement to another person, they don't respond as well. And then you stock your shelves accordingly to how many people do respond. And there's no objectivity to it. And what I noticed earlier on in practice is that there is a connection between the internal organs and the contraction around the spine because, basically when I got out of school as a chiropractor, I was focused more on biomechanical response. Then I had a guy come in one day, and he had spasm in his mid-thoracic spine, and there was no way that was going to be adjusted that day. There was just too much resistance. And a lot of chiropractors, they'll just sign you up on 50 visits and try and pound down that high spot. And all due respect to the chiropractors, we have a lot of great chiropractors out there. But the point is, if you don't get to the cause of why that muscle is contracting and that bone is going out of alignment and creating an interference with the nervous system, you're not going to make a difference with that person. So anyway, with this particular gentleman, I got to palpating his stomach, and his stomach was in knots. And I said to him, you're putting something in there. What's your diet like? And we talked about that. I said, do you drink any coffee? He says, a little bit. I said, how much coffee do you drink? 3 pots of coffee a day. I said, my advice to you is cut your coffee down to 2 cups a day and come in and see me in about 3 days. 3 days later, he comes in. He's at least 80% better. I was able to give him an adjustment that reduced more of his pain pattern that he was under. But the point was, I started noticing that visceral connection. And then in 1986, about 4 years later, I heard of Dr. Loomis and enzymes, and so I went to his seminar, and we talked about nutrition. And one thing he said to me, he says, you could give somebody the best nutritional supplement in the world, but if it's not digested and delivered to the cell where it needs to be, what the heck good is it? And my lights went on. And back then when we studied the chemistry of the body or how to evaluate the need for the chemistry, it was all done through 24-hour analysis and looking at blood work. And now it's evolved into a physical examination where you can actually track the muscle groups that are neurologically connected to the internal organs. So the doctors that have learned that evaluation are taking objectivity to nutrition where it really needs to go. So, I mean, you could, like Dr. Loomis said, you could take, the best supplements in the world, but if you're not breaking down and delivering them in the format, in the size that they need to be to feed that cell, that organ system's not going to function. Now, we have 10 different organ systems that maintain the environment around each and every cell, and we call that homeostasis. It's a balanced state. And ideally, all those organ systems need to work in sync. And when one of them is stressed because it doesn't have the energy, because it's not getting the nutrition it needs to function to do its part, then that particular organ system will exhibit symptoms.
Okay, so I think there's something to be said there, because as I listen and I just try to listen as a patient here and go, what am I hearing? Well, if I take this green salad with avocados on it, some pecans, and some tomatoes, some sliced apples maybe. Okay, so let's say we have that salad and I eat it. I presume that everything I'm chewing and eating is going to the direct places, because the innate intelligence on board, the governing intelligence that runs homeostasis, is doing its job behind the scenes, and that it's going everywhere it needs to go. Tell me how that may not be true, or, I mean, on one hand, it is true, and on the other hand, how do we verify that it's actually accurate in that body or in this body at that time?
Well, first of all, you have to know that your body is digesting what you're eating. It's like, is there any symptoms of discomfort after you eat? The bloating, the gas, the abdominal discomfort, that sort of thing. Those are clues, or, reflux. Those are clues that you're not digesting properly. Now, especially with a salad, you want to chew the salad. Any kind of raw vegetables, you really want to chew it, because chewing releases an enzyme in the cell wall of that vegetable, which will actually digest it. It's called cellulase, and it's in the cell wall, and it digests cellulose, which is what you're going to be needing to break down. So, and it happens to be an enzyme that the body does not produce. So it's very, very important to chew your salad. I wrote a book called "Do You Take Too Big a Bite?" Well, there's truth to that. We do take too big a bite, and it really means that we don't chew our food enough, and we don't have the digestive enzymes. Those digestive enzymes start to secrete into the salivary glands, and then there's a window in the stomach in which they start to break down your food. And then you have enzymes in raw foods that break down the food. And then, of course, if you supplement with enzymes, that will break down that food in that first window, 30 to 60 minutes. A lot of people think that enzymes get destroyed in the stomach because of the acid. Well, that's really a big misconception, because acid is needed to activate the inactive form of pepsin, which is called pepsinogen, and it needs to convert it to pepsin, and you need the acid environment to convert it. And pepsin is what breaks down protein. So if you don't have that, if you're on some kind of an acid, or you're blocking that pathway by neutralizing the acid, you're going to interfere with protein digestion. And protein is used for a lot of things in the body, for growth and repair, for formation of essential body compounds, for antibody formation, maintenance of acid-alkaline balance, regulation of water, transport of nutrients and waste, removal of toxins. So there's a lot of things that you need, those macronutrients. Hormones, yes. Hormones are protein and fat. So, we're looking at, taking those macronutrients. Now, the other thing about macronutrients and micronutrients, when we're talking about micronutrients, vitamins and minerals, you cannot utilize vitamins and minerals unless the macronutrients are digested and absorbed.
Time out. It's worth stopping there. So let's go back to the individual on this point. Let's go back to the individual that is taking an antacid because they actually have some symptoms of acid burning up the esophagus. That's all we can say. We can't talk about disease here with Dr. Lou, that anybody's treating them. We're talking about what happens when patients are doing what they seem to be doing the right thing. Like you're taking vitamins, you're taking supplements, you're trying to eat healthy, and yet are we manifesting health, or do you still have symptoms of burning or regurgitation or reflux if it's a child? And when they're put on a drug that is an antacid, whether it's over the counter like Tums or a PPI like Xanax, is that Xanax?
Mm-hmm.
The purple pill, when you're looking at what your body is doing there, when you reduce the acid, tell us what happens there, Dr. Lou, when you're reducing that acid, and then the sequence of events that as a result.
Right. Well, when you reduce the acid, you interfere with protein digestion. And also, you interfere with digestion of fat, too, because it's the acidic solution that we call it chyme that drops down from the stomach into the duodenum, or the first part of the small intestine. And it all depends on how much acid there is coming down. The more acid there is, the more bile is secreted from the gallbladder, from the liver through the gallbladder into the duodenum. And you need bile to emulsify the fat. So that's the first start. Emulsification, it kind of expands that fat molecule so it has more surface area for lipase, which is the enzyme that breaks it down to start doing its job. So that's one of the problems. So you become protein deficient in all those things that I mentioned earlier that the protein is needed for in the body. Those mechanisms are not going to be fed. And so you're going to start to establish symptoms, of a protein deficiency. Protein holds water in circulation. So you get cold hands and cold feet. Protein is also needed for calcium. Half the calcium is bound by protein. So you could get muscle cramps at night. That's tied in with calcium. Menstrual cramps also is a protein calcium issue. So there's a lot of symptoms that start to occur when the body doesn't initially get the macronutrients for energy, but then it doesn't have the engagement of the micronutrients. Remember I said that micronutrients are not utilized unless the macronutrients are digested and absorbed. There's a key component there that nutrition misses. And you have to address that in order for the body to be healthy and to function and do what it's supposed to do. And it's only deviation from normal function that the symptoms occur. I mean, I've read my whole two of my practices, because two of them I used enzymes. The first one I did not. But both of them were done by looking at, okay, what is this body in front of me? Because everyone's a little bit different. We're not average. Yeah. So everyone has a uniqueness to the breakdown of their nutrition that they're not getting. And because of the nutrition they're not getting, different organ systems are now starting to be compromised. So there's a kind of a combination of different things that will manifest slightly different for everybody. Are there tendency to go one direction or the other if you don't have fat, if you don't have protein, or you don't have complex carbs? Of course, but you have to look at the overall picture. So you have to look at all of the organ systems. Are they doing their job? Are they working in sync? Are they working too fast, too slow? Out of time with what the need is for the body. So there is a whole gamut of things that needs to be looked at. And if I'm getting off track here, please reel me in, because I love this work. And what has motivated me is the fact that anybody that has come to see me in the past, and anyone that calls me on the phone, because I work primarily with practitioners now over the phone and help them solve cases by saying, okay, what have you evaluated with this person that tells you how they're deviating from homeostasis? So it's about understanding deviations from homeostasis and what the need is for the nutrition to feed that organ that's not getting the energy. And because it's not getting the energy, it's exhibiting symptoms. And that's pure and simple.
Okay, so if there's it's not a reel in either, by the way, you're doing great. But if we pull back just a bit and look at where the system goes wrong, because again, you got all kinds of opinions coming in. I know after dealing with this daily, is the good intention is to try to solve a symptom with some nutrients. Now, that's not wrong in any way. It's just how we're going about it. And we're missing the fact that way up top in the sequence of priority, up here in the priority at the top of the list is my macronutrients.
Correct.
At the bottom of the list is vitamins and minerals. Correct. In their most micronutrient form. And
right.
We're trying to solve problems at times with, which I had done in the past, with micronutrients, trying to dose them to solve that problem. And they can make a change, like you alluded to in the beginning, in 10 patients very differently in all of them.
Right.
Maybe 6 out of the 10 get better, but 4, 1 gets worse and 3 struggle, whatever the numbers may be.
Mm-hmm.
But that's the question I had, is why and how do we get more specific? So what I love about what you're saying, Dr. Lou, is first of all, in knowing the Loomis work, is until we deal with the macronutrient absorption, we're still chasing things downstream on a symptomatic level.
Right, but we have to start with the diet first, because where is the macronutrients coming from? That's got to be
right.
key. There's a lot of diets out there, and I know the keto diet is a big thing now. But the point is, no matter what diet you're eating, the question is, do you have the enzymes to break that macronutrient down into usable form so that you can use that to feed the body? That's key. So you have to start there. So to really help someone regain their energy level, you have to first look at their diet, and that's kind of what we do as nutritionists. We start with the diet. What are you eating? What is the stress that's overwhelming that body? Because if you're a carb lover and you eat a lot of carbs, you'll probably eat more carbs if you can't digest them, because the brain says, hey, I'm not getting enough Cheetos here or ding dongs or whatever it is that they have a craving for, because the brain says, I didn't get it, so give me more.
That's perfect. So what Dr. Lou is actually saying, to break this down, and again, I'm going to oversimplify this from the standpoint of every day I get the deer in the headlight look. What do you crave? The 2 questions I ask: what do you avoid and what do you crave? Why? It's essential to understand what a patient's going through to then determine if I crave carbs and salt. Great. We have an idea what you're not digesting. Why? Dr. Lou's just saying, if you crave it, you're not satiating it. If you satiate it and your brain says, ooh, I got it. So in other words, top of the tube, bottom of the tube. Food goes through the tube. If it doesn't get into the tissues, like we alluded to earlier, then the body cannot get satiated. The cells don't get nourished, so the body reaches for more. It knows where to find energy. It's just not getting it, or it's getting it in short-term bursts cheaply through that carbohydrate/sugar and shortcut ways. So you say, well, wait, I'm getting energy because I'm eating the Cheetos or I'm eating whatever it is. And yet your insulin spikes, your blood sugar spike, and so you get short-term bursts, but then you crash hard. And this chronic cycle is not healthy. So back to what Dr. Lou is stating is that, correct me if I'm wrong, by the way, is that first you have to have good food going in, but you actually have to then digest the good food, because many of us do eat good, healthy food, but we're not digesting it well because of historical deficits from the chronic stress we've been under. Is that correct?
That's correct.
So if all live food has enzymes in it to digest that level of food, like an apple has just the right amount of enzymes to digest itself, until we do what? We cook it, and we heat them up. Irradiate it. We kill them. So now if you're eating apple pie or apple tort or apple crisp, you've now got to create your own enzymes to break that down and assimilate it. Otherwise, it's a stress to the body, and the body is now having to pull energy out of its system to, number one, digest the food and then maintain homeostasis at the same time.
Correct.
So knowing that, and when you build on that from a brain and blood sugar standpoint, what the brain's looking for, and then maybe how you tie in the fact that enzymes and coenzymes and why in the different types of enzymes in the body that are, let's say, therapeutic versus metabolic, and then some.
Okay. Well, first of all, the ideal state of the brain is calm and alert. And when it's really in that zone, they call it the zone. That's what they also can call the meditative state. And in that meditative state, the brain frequencies are all coherent throughout all parts of the brain. And we constantly deal with, the extremes of either anxiety or depression. So we're either too up or we're too down. So you could put emotions into any, a variation of that. So you don't take care of anxiety by putting them on an antidepressant, or you don't, deal with depression by making them more anxious. So basically, you have to use food to satisfy the brain, and the brain initially looks for glucose, and it wants that first before any other part of the body, so we can focus, and so the brain can maintain the control over homeostasis, to balance those 10 different organ systems, to coordinate them, so the brain can say, hey, bring more energy over here, take less over here, make more blood supply this way, less that way, that sort of thing. So you have to look at that whole coordination and the brain. Now, there was a doctor that did a lot of research with getting his patients to deal with their food cravings. Remember, we talked about food cravings, and we're not getting it, so we crave the food. Well, he got them to meditate to deal with their food cravings, but then that wasn't always very lasting, because if they weren't digesting that food, you can only meditate for so long and you run out of energy. So it's a combination of certain foods will have a certain effect on the brain. It'll create a certain brain focus, a certain brain pattern, a certain emotional state. But again, it's back to really what we want to be is alert and calm. Kind of like if you take a 10th degree black belt, karate expert. I mean, it could be having this conversation right now. Let's say if I was a black belt in karate and I had reached the top of my field in that, I could be talking to you right now, and someone could be aiming an arrow at my head, and I'd be so calm and so alert that I could just grab the arrow and prevent it from going into my head. but I mean, that's the ultimate, Superman. But the point is, we want to be able to focus so that we can really listen to our heart and do what we love. They're discovering now that there's more communication in the direction from the heart to the brain than the brain to the heart. But then the brain controls the rest of the body. So actually, we're designed to listen to our heart. And what's in our heart is the emotional state of love and doing what we love. When patients come to see you in practice, I mean, if there's any practitioners out there listening, basically what you're helping them to do is to do what they love. Yeah, they came in with low back pain, and the low back pain is interfering with them lifting their grandchildren, but what they really want is to lift their grandchildren. So, and what everybody wants is to do what they love, because when you do what you love, you do it from a place of passion, and you do it from a place of inspiration. And ideally, why do we eat? So we can have energy to do what we love. Why? We don't want to eat to do things that we hate, but yet we have to do them anyway. And many of us are stuck in that, hating our jobs, or not liking our relationships, or whatever it is. I mean, and then we'll crave accordingly to the stress that's overloading our environment, our lifestyle. So besides diet, we got to look at lifestyle changes.
Nobody wants to change their lifestyle if they don't have to.
Right. Can you work around it? That's why you hear a lot in practice, right?
Right.
Can you work around that?
I just put up an episode today about the reality when you talk about restriction, when you talk about, removing a food as an obstacle that isn't necessarily, or it's causing inflammation in the body. And all the emotions that are wrapped around that restrictive mindset, like, oh my gosh, you're taking something away from me. And that emotion puts the brakes on and creates this avoidance, and it's a form of stress. Instead of, until we wrap our heads around this and say, wait, there's a gift in this. Because the solution to the problem can be a temporary avoidance in order to then be able to heal the body enough to then absorb, digest properly. And so it's just an interesting dynamic, because I saw this patient just say, there was passion to get better, and then all of a sudden there was the brakes on, and it was super realistic. Mm-hmm. My social life depends on my ability to have those carbohydrates by a campfire, mm-hmm. in a bottle. And I get it, completely get it. So there's no judgment. It's just, at some point we have to stare or look in the face. Okay, where's this coming from? And if we're truly going to get our body back and actually live, like you're saying, from the heart and the life of our destiny and our dreams, whatever, and go after that, then we're going to have to come to some realization. And there's a way to do it, which is cool. So mm-hmm. there's some evolution to what I'm talking about, especially with this individual, because once we turned her on to this, she literally responded back after thought process and said, oh my gosh, I did the research. I looked into this. It's amazing. I cannot believe how much myth information I was looking at mm-hmm. from all these other resources when they were just like propaganda, so to speak. So I love what you're doing, and I greatly appreciate your knowledge with it. And I've consulted with you, as you know, many times. I will literally be calling Lou or shooting him a text. Not that I'm promoting that for your peeps, but if you're okay with that. The point is, he has helped me solve problems because he's so quick on, what else is going on. And the big picture is what we're really trying to address here tonight is I see myself as a problem solver. That's what I'm here to do. And I'm here to share and give people, patients, my community options, because they're not always given those options. And it's not a one way fits all, like you said earlier. It's not a one diet fits all. It's an individual at a given time based on a life experience, their history, their genetics, their epigenetics, the chronic stress they've been under, the depletion with which their nutrients, because we can talk about theory, and if you take vitamin B, you get this, and if you take B12, you get that, and if you take your D, you get a great immune system. And I got to say, that's a bunch of BS. I'm very pro-nutrition, but you got to test the individual, is what you're saying, to find what they need at that time, and then their body becomes more brilliant in the process.
Exactly. And they'll need different things at different times. So,
exactly.
You can examine someone in the morning and they'll, especially when it comes to chiropractic, those of you that have been to a chiropractor and get adjusted, and they go in the morning and they adjust great, but they go in the afternoon, right after lunch, and they won't adjust at all. So you're looking at, well, what's going on? Well, maybe something that they ate created an internal organ stress that created muscle contraction because that organ was neurologically connected to the muscles. Remember the guy with the drinking 3 pots of coffee, So it can be that simple. So the thing is, we could get overwhelmed reading all the articles and getting all confused about what to do nutritionally. And so we read the article, we go out and we go to the Whole Foods or whatever vitamin shop, and we buy a bottle of this because we just heard someone talk about, like you said, vitamin D or whatever. And so, we're set in that mindset, more is better, so we'll just make more of it. And it doesn't do us any justice, because too much can overwhelm the body and create a stress from taking a supplement that you think is going to help you, but because you're doing or taking too much of it, that can overwhelm the process of the body having to process it and use it for what it needs to, deal with it, what it's needed for. But it has to get rid of the excess. And that's a stress too, getting rid of the waste.
Nice. I think that's a huge point. We're definitely going to be diving into the process of, I want to say 2 words here, metabolizing and methylation. I want to say how the body metabolizes nutrition, utilizes it, breaks it down and implements it in those tissues, and how it also removes waste through the methylation process. We hear a lot of talk about, the genetic tendencies and SNPs that we have. And yet we still can influence that's why micronutrient high dosing, overdosing, like creating imbalances in the body. Can you elaborate on that for us, Dr. Lou? What it's like to take small, like isolated nutrients like ascorbic acid high dose or vitamin D in super high doses. What does that actually act like in the body?
Well, you have to realize that nature knew what it was doing when it put certain nutrients together with other nutrients. So, as a supplement company, we try to use, whole foods as much as we can. Sometimes we have to add in extra vitamins or minerals because the body has a tendency to be depleted in that in certain cases. But ideally, you don't need much. You don't need that RDA. You don't need as much as what they say you need. That's done with the general public, and saying the general public, we've done studies across the board and say, the RDA requirement for this is this much. But really, if the body, like I was saying before, if the body's getting the macronutrients, the carbohydrates, the fats, the proteins, and they're digested and absorbed, the micronutrients are needed then for the enzymes to work, especially the metabolic enzymes, the ones that run all the other processes of the body. So you have digestive enzymes and you have metabolic enzymes. So you have digestive enzymes that are in digestive tract, starting with the enzymes in your mouth, and then you have enzymes in your raw foods, and you have enzymes that you can supplement. So if you want to take the stress off because you're eating cooked or processed or genetically engineered foods or GMO foods, and they're designed to reduce the enzymes. That's why genetically modified foods last longer. I mean, you go to the store and buy an apple that's not organic, and you set it on your counter, and a month later it still looks good. You wonder why? Because they've genetically modified the enzymes out of it. So in that particular case, now the body's got to come up with more enzymes to break that apple down. So when you don't have enough enzymes to break it down, and let's say you partially digest it, but because you got leaky gut, which means that things get across the gut lining and get into your system that really should get in there because your defense system is down. Well, you see, your defense system, your white blood cells, that's how they function. They use enzymes. They actually use enzymes to go after bacteria and viruses and that sort of thing. But if you have a macronutrient that was partially digested because you ran out of enzymes or it was genetically modified or whatever, and that gets across the gut lining, but it's too big to get into the cell, then your immune system will use its enzymes to finish the process. And if that doesn't happen, those big molecules will drop into the tissues around different organ systems. And guess what happens? You get inflammation, this redness, the swelling, the pain. That is the body's inability to clean up the environment because it's being polluted with too many things that it can't handle. It's overwhelmed. Would you like to add to that?
Yeah, I mean, the leaky gut is like so rampant and common. We have to get that under control because, again, autoimmune diseases are on the rise. I mean, we're seeing it crazy, and the stats on it are amazing. The likelihood after 10 years, well, in 10 years, if you have already one autoimmune, is that it's 100% likely in 10 years you'll have another. And part of that reason is because of the methodology that's being used medically to treat it. You're just using drugs. You're not stopping the inflammatory process in the body. And I think it's of note that significance, we need to go back to homeostasis and why that happens. There's so much talk and confusion, and this is a little bit of a rant, but there's talk of the immune system's dumb, the body's attacking itself. No, it's not attacking itself. The body is defending itself.
Absolutely.
From stuff that doesn't belong there. So Dr. Lou is alluding to tears in what's called the tight junctions of your villi in the colon, where your body is designed to absorb massive amounts on surface area, massive amounts through the villi, nutrients that are broken down. However, when digestion is poor, key side note, PPI people, reflux medicating people, you're reducing the digestive process and absorption of your nutrients. Therefore, bigger chunks of food bolus end up where it shouldn't be and undigested, and that's where it starts to leak through that colon and raise havoc with your immune system, right?
Mm-hmm. That is true. A point I'd like to make is, we're talking about, of course, the nutrition. If we're talking about feeding the body, and we're talking about giving the body energy it needs, and the macronutrients and the micronutrients, and all of that, and that's great, because what the body really wants to do, it wants to survive. Every cell has a desire to live. So, but really what you're doing is you're supporting the healthy function of all those organs that want to live, that want to optimize their function. So really, when you're taking a nutrient, when you're eating a healthy diet, and if you're taking the right amount of nutrients, the right kind of nutrients, and the right kind of diet, then you're really supporting healthy function, and the body has an innate intelligence to heal itself.
Let's definitely move towards healthy function and what you're capable of when you set the environment up to win.
Right. I mean, nothing is going to heal the body but the body itself. Okay. So, you could throw drugs at it. And I'm not anti-drug, because, some people, they need a drug to keep them from falling off a cliff. And absolutely, if that's the case and they want to stay on the planet, then listen to your doctor about the medication that's going to keep you from falling off the cliff.
Absolutely.
There's nothing wrong with that. The point is, the drug guy was at Eli Lilly said a drug is no drug at all unless it has a side effect. So you're always going to get a side effect with drugs, and you can get side effects from taking massive doses of micronutrients also.
Yeah.
And you can get side effects, as we well know, of eating a big meal like Thanksgiving dinner that we don't have the enzymes to digest. You're going to get side effects there too, But the point is this, that healing is designed within the body itself, and if you reduce the stress, especially from the lifestyle, which includes what we choose, what we put in our mouth, if you reduce that, give the body what it needs, help it digest what it needs, and you have the adjunct of the micronutrients, and ideally, from an organic diet that's grown in good soil, should have all that in there. Unfortunately, even organic is depleted sometimes of the minerals that it needs. It just doesn't have all the pesticides and all of that in it. But still, those soils could be depleted even if they're organic. Then you wonder why do I need the supplement? Well, sometimes you need the supplement because we're not getting it from the environment that we used to get. Our forefathers, had organic farms, and the soils were plentiful with all the nutrients that it needed. And, I remember my dad had a garden, and we used to eat these amazing tomatoes. We'd walk in the garden with with salt and pepper and eat them right off the vine, and we were satisfied. And, it was like eating candy for us. But maybe that's not the case anymore. So, you almost have to supplement, but you have to be wise about the kind of supplements you choose, and you have to be wise about when you need a particular supplement. And chances are you don't need as much as you think you do.
I think that's great wisdom, just from a conservative standpoint, in that I'm glad you brought it back, as we could get off a little bit there, regarding some of the focus around treating things versus what are we really trying to accomplish, and where does the foundation sit? The foundation is back to homeostasis. The body's brilliant. It's always going to maintain that homeostatic survival level. So how do we assist or get in the way of that? And by assisting, we're conscious of what we consume. We do our best, because we do our best to get organic whenever possible. But are there those cases when not? Yes. But I think, patients and docs that aren't necessarily this deep in nutrition want to understand that the GMOs, who does the GMO serve in terms of why, there's still some confusion, like, well, they must be good for us because they've allowed it to happen. And it's really not about the health of the body. It's about the shelf life of the fruit or the vegetable, right? The longevity. And so now when you take enzymes out, which Dr. Liu alluded to, when you take those enzymes out, you have less to break. The food doesn't have what it needs to break down those nutrients. So now you're calling on your body, which is a demand, and there is no infinite supply. Is that correct?
Mm-hmm.
We have to replenish. And we know that as we age, we lose our ability to produce hydrochloric acid in our body. So then our ability for protein digestion goes down. We're not in a high growth phase, but we certainly have need for repair at times and maintenance. So it's such fascinating work to just put the big picture together and realize that first, just do the basic things. So tips, let's talk about tips for those listening and or action steps. I mean, if they understand homeostasis is always happening in the background, then when they have a free Sunday and they eat whatever they want, that's why they're tired the next day.
Well, there was a study published in the New York Times, and I believe it's probably about 25 years ago now. There was a study that said if you undereat, you could add 20 years to your life. So a tip would be, what you normally eat in volume of what's on your plate, cut it down, cut it in half if you can. You'll get used to that, but then what's the benefit going to be? You're not going to overwhelm the body and overwhelm the enzymes needed to digest that food. You're going to give the body a chance to break down what you are eating, and maybe you might have a side benefit of losing the extra 5 pounds that you've been wanting to lose as well. So that's one tip. The other tip is, eat organic. Of course, you want to eat organic as much as you possibly can and avoid all the, toxins that are put into our foods. That's key. So undereat, eat organic, chew your food. That's big. How many times do you chew your food? You should, chew it 20, 25 times, Ideally, break it down. Let it become liquid in your mouth. Of course, you're always in a hurry. And that brings up another topic. Eat in a calm, relaxed environment, because the part of your system that is responsible for digestion, which is the parasympathetic nervous system, there's a calm environment that it functions best in. Otherwise, you're in fight or flight or sympathetic dominance. So don't be watching CNN when you're eating your meal, or you're not going to be digesting your food properly. You're going to want to go fight or get angry at what you're hearing on the news. That's going to shunt your blood away from your digestive tract into your muscles because you're ready to punch somebody. So these are all the little tidbits to think about.
They're great tips. The take-homes, the take-homes are important. Is there anything else you want to add? Anything that you want to circle back around where there's like common themes? For example, what people don't always associate. And then I think that's pretty fascinating when, for example, the patient I was just referring to with the talk about restricting a certain food group specifically for that individual, there was hip pain, and the hip pain was related to digestion. That's how I knew where to go, because structurally I was adjusting and she was responding great, but the stability wasn't there. So I knew that A, she wasn't digesting protein well, and B, let me just say I'm not diagnosing with that as much as I was keen to where her body was showing deficiency and where we need to improve the function. And once we started that, things started clicking with the patient.
Well, what that brings to mind as you talk about that is identifying the source of stress. Is the stress emotional in nature? Is it physical in nature? And is it chemical in nature, which of course is diet and the chemistry of the body? So identifying that source of stress, maybe you need to change your job. Maybe you need to change your diet. Maybe you need to change your relationship. Or, I'm not saying, get another person. But what I'm saying is maybe there's something about your relationship you need to address, and address the truth behind a situation that's giving you emotional stress, that's using up energy. Any kind of stress creates more nutritional demand. And because of the more nutritional demand, when the body runs out of that nutrition, it exhibits symptoms, because now the organs that are maintaining homeostasis are not doing their job. And when those organ systems are stressed, it's the symptoms of that organ will start to be exhibited.
Beautiful. And based on the law of homeostasis, the body will try to find those nutrients somewhere.
Yes. And it will.
Where does it grab them from?
Mm-hmm. Yes. Yes. Well, look at calcium, for instance. I mean, you go get blood work and say, well, I checked my calcium levels, and they look normal in the blood, but yet you go get an X-ray and you got osteopenia or osteoporosis. Well, the body's homeostatic mechanism will take calcium right out of the bone to put it in the blood because the blood has priority, and will steal it from other parts of the body because it needs to be maintaining homeostasis, and the blood is the distribution system.
Beautiful. So that is key. There will be more discussion on homeostasis upcoming. It is such a kick butt topic in terms of just putting the big picture of what the body's doing. Otherwise, you're just throwing bullets at it all the time, trying to treat this. And it's like, well, what? The body's intelligence, that's the foundation. It's going to keep the pH consistent as long as it can. And if it doesn't, we're what? We're dead, right?
Right.
There's not a big deviation from that range.
No.
And by the time the blood shows it, oftentimes that's more detrimental and quite severe at that stage. I'll say it very lightly, but you're definitely in the emergency room by those cases. And when it shows in the blood, just from all the knowledge I've learned through the Loomis Institute, is that when you're looking at UAs, you're looking at yesterday's blood, right? Constituents. And you're not going to necessarily see all those when the body's able to pull it from tissues. So it can hide some of those deficiencies, but yet you still do show the symptoms. That's why your doc has probably said your blood findings are normal. Mm-hmm. They're within a normal range, and yet you still have these symptoms that can't be answered. That's part of that link, correct?
Yes, and to add what you just said about the blood looking normal, well, that's actually a good thing because you can look at it this way: you're not in a disease state yet. So because you're not in a disease state, you could find a practitioner who looks at nutrition objectively and evaluate you individually to see what your body needs. So there's hope for you. If the blood work looks normal, there's hope for you. But if you do a physical examination, if you understood, and there's many practitioners that have been trained to look at the muscle groups that's connected to the liver, to the spleen, to the kidney. And in that evaluation of physical examination, you can tell how the body's starting to compromise. You can look at a 24-hour and see what the body's trying to save and what it's trying to get rid of. And there are practitioners like yourself that do these evaluations. So those of you practitioners that are on this call, that are listening to this right now, I encourage you to find one of those doctors. I mean, you certainly, can call me at the Loomis, Loomis Enzymes, and I will, have someone direct you to someone in your area. And those of you that have not really looked into, making nutrition very objective, I encourage you to go get trained. So that you could put all the pieces together. And, you could talk about that a little bit, how you got trained, Dr. Anderson, and how it's changed your practice. Why don't you share a little bit of that?
Yeah, it's changed my life. I'll discuss more in upcoming podcasts as well. There's some things that are unwinding, but I will put it this way. It saved my life. It saved my wife, Dr. Heather's, situation that she was in. And we already worked with nutrition for years, but she was in a situation that was devastating for her. And Loomis Enzymes and the whole process of being able to evaluate and determine where her needs were literally was a difference maker, because she was already on micronutrients that we were working with. And she was hitting the ceiling. And so that I owe a tremendous debt to Dr. Loomis as well, but we already awarded him from that. So the key is, it literally changed how my perspective of what we were able to influence and what I didn't know at the time, and how clueless I was as to how to go upstream from the neurology, from the subluxation, from all the dynamics of spinal dysfunction. And yeah, we were influencing the brain and neurology, but what we weren't getting at is why that system remained under such great stress. And to determine now, like you'd said, where organically, because of the embryologic development of the body, were these party lines traveling together, which is where we get that, that involuntary muscle contraction that's correlated to a system or tissues and organ system of stress. And that's very measurable. So once I was really opened up to that world, it was awesome. And it still is. I cannot see the body any differently. So whatever. But that's what I love about being able to test a patient and go, because when I do a prone exam and I do a supine exam, I'm giving them information that they've never heard before, that they can't even understand how you can tell that. Mm-hmm. And my job as a provider is to tell the patient, ask questions as a detective, but then tell the patient what they're actually experiencing with that. And it just many times knocks their socks off, because they're like, how the heck do you know that? And and it's science. That's what's cool, is it's there. So I love it. I love the work.
That's great. I love it too. I mean, I left my very busy practice to work for this company, because my justification was I need to help more people. And there's only so much you could do, as you know, being in private practice. So I decided I'm going to help a lot more people by helping a lot more doctors understand this work. And that's my passion now, because I live vicariously through you guys. So I'm grateful for you, Dr. Anderson, for doing the great work that you do in your practice. And not only that you do for other people, but you do for me, because, coming to see you has been just awesome. And I really appreciate you. And I'm grateful to share it on this, broadcast.
Well, I appreciate you, Dr. Lou, and you've helped me out of a number of situations with patients, just to be able to willingly give advice and insight, and just to help me understand it. So, I mean, my wife gets ticked because I ask, 20,000 questions, and she's like, stop asking so many questions. I'm like, I got to understand it. And right. I'm a big picture guy, so I got to understand the workings of it. Mm-hmm. The work that Dr. Loomis has done over time is, people can read about if they go in. I will have all the information for Dr. Lou. If you're a provider, if you're a patient and you're in, let's say, Texas, or you're in Oklahoma, or you're in Mississippi, and you see this and you want to find somebody who does very specific work like this, there's a website, and I'll put that link in there, and you can find a provider that is certified in your area. And the real key is that you start to get results. If you're not getting results, start to get results. If you're getting great results, keep at it. Keep doing what you're doing. And that's a shout out to those watching. But anything else you want to add, Dr. Lou?
Just one more thing about the information. The other thing you could do is go to Amazon and look for books written by Dr. Howard Loomis. He's written several books now, and you can get started with educating yourself on enzymes and how they work and how it can benefit you.
I'll actually list those on the Frankly Speaking website as well, and they'll be in the podcast when they're up. I will list Dr. Loomis's both female enzyme book, overall health, and three of them? Are there 3 books?
Yeah, there's 3, I believe, yes.
Okay, and so I'll have the titles of those on there and links where you can find them. So Dr. Lou is, this is only part of what he likes to talk about. We'll talk about some other cool stuff upcoming. We'll have him on again, I'm sure.
Well, thank you. It was a pleasure being on, and I appreciate your time and your enthusiasm and your love for this work.
Thank you, brother. I appreciate you very much, and thanks for being here with us tonight when you've already had a long day. I caught Dr. Lou when he was walking in the door. It's time to go. So thanks again for watching, and we will look forward to seeing you guys next time.
All right. Thank you.
As always, I just want to thank you so much for listening to this week's episode, and I look forward to our next time. Okay, my fellow health warriors, it's time to head over to iTunes, frankly speaking, drwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice and their health. Speaking up means you matter. We'll see you next time. This podcast is for information purposes only. The statements and views expressed are not medical advice and are not meant to replace the medical advice of your doctor. This podcast, including Dr. Wade Antonsen and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.